The broadcast is now starting. All attendees are in listen-only mode.
Hello, good afternoon, everyone. This is Rebecca with WFIA. Thank you for joining our weekly update webinar. As always, we start everyone off muted, and we will unmute everyone as we get to the question portion. You can also ask questions over in the little question box or raise your hand if you want to talk. Please mute yourself on your end so that when we do unmute everyone, we're not getting any background noise. And if you need to step off this call for any reason, please do not put us on hold because then we get your background music. And with that, I will turn it over to Jan.
Good afternoon. This is Jan G, your president and CEO, and we have all the staff on the call today to answer your questions. Tammy's here, Kat, Melissa, Robert, and of course Rebecca and me. So we're all here. Whatever your questions may be, we're here to answer them. We don't have a guest speaker this week. The staff is going to be reviewing the complex series of proclamations and guidelines that have been coming out of the governor's office and the various agencies. It has been a pretty tough week, and we're hoping that we're going to be able to add clarity in a more simple fashion for you as we've gone through all the weeds and got to what's important to you. If you missed our email, excuse me, after our last webinar, then you don't know that your voice was heard last time, and it was about 36 hours after our webinar that the governor's office notified us that they were adding a medical exemption in on the staff requirements for masks. So in order to protect yourself against labor and industries and any penalties, we are suggesting that you ask your employees for doctor notes, keep those in file. If they can't get a doctor's note and they're not covered by health care to get it or anything of that sort, we do know that Rose Ours has created an affidavit style form and has asked the employees to fill that out, and then they put that on file. We had hoped to have it on the website before our call today, but we weren't able to get that up and posted yet, but it should be up sometime tomorrow. So if they don't have a doctor's note, download that blank and have your employees fill that out. As of yesterday, June 8th, the signage for your stores is mandated, as we discussed before. We were waiting for the governor's office to produce that sign with their own governor seal on it to give it authority. And after waiting over a week, they said, no, we don't want to put our seal on it. So Melissa and Tammy worked together to create a sign on there. It's called the Face Mask and Social Distancing Notice Poster. So it states there that it is the governor's proclamation that are causing everybody to wear a mask and maintain social distancing. And it also puts a little piece in there that, let's see, did that come out, Tammy, about the medical exemption? Oh, no, there's the language right there. It says, wearing a mask doesn't replace social distancing. Please respect those that cannot wear a mask by maintaining 6 feet at all times. So that is just kind of to help you if one of your customers complains that an employee is not wearing a mask, that there is a medical exemption. So you're free to download that sign and use it. And Melissa, is it set up in a way on our website that our members can modify it if they want to use a majority of it, but want to make a slight change?
No, it's not currently set up that way.
Okay. But if you want it emailed to you in a format that you could change it, you could get a hold of Melissa at wa-food-ind.org. Melissa is our genius in the graphics area. The mask requirements have been a moving target between the governor's office, LNI, and Department of Health. And to the best of our ability, based on their conflicting direction, that is, this is what you should consider on masks for your employees. There is a new document up. It is called, under the new which mask for which task. And it's got a cover that shows 4 different masks, but then if you turn the page, you go in there, and they actually list 7, let's see, 6 different levels of mask usage, and what is that based on. As we went through that document, we determined that all of our employees in both our stores and our warehouses will fit in under the low risk and the medium risk. And this is where it gets complicated and is different than what we've been told before. Low risk is the reusable mask that most of you have already provided to your employees. Medium risk is a disposable mask. It shows a picture here of the hard mask, but the little blue soft surgical style masks are also considered disposable masks. Unfortunately, they have named out a number of types of jobs, tasks within our grocery stores that would move our employees from a low risk position up to a medium risk. So you will be required to provide disposable masks to those folks. And there's a real key provision, and the key provision to look at is under that second paragraph of that medium risk, because it says risk transmission is considered medium when you stay at least 6 feet away from others, except for several times throughout the day when the 6-foot distance is broken for several minutes. And prevention measures such as physical barriers aren't feasible. So if you think about, and they actually in the list down there, they call out our grocery store produce stockers who are working during open store hours, and customers are shopping for produce, and they're there restocking. But then there was another additional document that came out separate from this that was for restaurants. And we always read the restaurant directives because they throw our delis in with the restaurants. And we started to look at that, and sure enough, in that restaurant document, it says any of the chef, the prep people in the kitchen are considered medium risk because they're walking around each other, interacting, that type of thing. So when we look at this definition, we look at the 6 feet and several minutes throughout the day, several times throughout the day for several minutes, then we have to determine that it is very likely that our delis, our bakeries, and possibly our meat department where our cutters and wrappers are interfacing together could also be considered medium risk. But this is an analysis you're going to have to be able to do for your own business. So we went back over to the low risk, and although it doesn't talk about barriers here, the barriers do count. So again, if you have your frontline associates and you've got the plexiglass up there, that is a barrier, so that would keep that person under the low risk categories. However, if you have a bagger that's standing there and not behind that plexiglass, then they will move into the medium risk classification. So let's see, key exception for this, if you look at the second paragraph under low risk, it says the risk transmission is low when you work around or travel with others and you stay at least 6 feet apart, except for briefly passing by another up to several times a day. So, you know, if you look at this and you consider, you know, your employees' tasks during the day, it's going to be a difficult task for you to determine which is your low risk, which is going to be your medium risk, and provide those disposable masks. So let's see, I want to check my notes and make sure I've covered everything in this area. So Tammy, Tammy got clarification because we have had off and on supplies, but we do, I believe, have Larry with Bunzel on the call, but so he can talk about supply issues with multiple gloves, masks, all that. But Tammy again went back to Ellen and I to work with them and said, what if we can't get disposable masks? What do we do now? So Tammy, do you want to cover that? And it's posted also on our website.
Yes, thank you. So I wanted to get a little clarity on this medium risk worker and what we can do, because we are still struggling with different types of masks. First of all, I did want to note that there's a link again on masks that was separate from the other document on which mask to wear. And that does say that face shield combined with a minimum face covering also will meet that minimum risk protection. But what I was told is that if your supply is temporarily low, ensure that all workers are wearing at a minimum a cloth face covering, and emphasize to workers to use social distancing of at least 6 feet, except in passing at essentially all times. And have already placed an adequate order for disposable masks for workers that need more than a cloth face covering, and keep the documentation of the order and estimated arrival date. They also ask that a supervisor is walking the floor to ensure social distancing is continuously enforced throughout the shift. That will suffice for DOSH enforcement. So we have this all posted for you, but it does sound like DOSH may be starting to come out and make sure that we're all doing the right thing.
And we had, thanks Tammy, we had 2 member questions come in prior to the webinar dealing directly with masks, and I wanted to read those. Some of them we've answered in what we've discussed so far, but Jamie from Blanton, she's very active on our calls and submitting questions. So she says, when an employee can keep 6 foot distancing, is it acceptable for him or her to lower the mask during that time? So she's giving an example of somebody that's stocking a shelf or something and nobody's in the aisle. And no, that's not okay. Not anymore, anyway. So you must always have a mask, even if you have 6-foot distancing. So if you recall when I pointed out that provision under the medium risk there, everyone must keep the 6-foot distancing. It is all how many people you come in contact for how long of a time. But you must tell your employees that are stocking shelves and the stores open to keep their mask on. If they're working there by themselves, they're not coming in contact with anybody, of course. And then she also says, my understanding of the mask rule is masks are required to be worn when 6-foot distancing cannot be kept. And as I just said, that used to be the rule, but it's not anymore. So sorry. We're going to unmute you all here too if others have questions. But the other question came in from Phil at PNB Mercados and our chair of the board. And his question is, what is the state saying about vendors wearing masks? And he says it seems like it's all over the board. Well, it used to be, Phil, but it's not anymore. So your vendors, you must determine if they're in a low risk or a medium risk task. If they're just stocking a shelf and they're pretty much isolated from everybody, keeping 6-foot distancing, you put them in low risk. But if they're working with your employees on pricing or display or anything of that sort, where they're having exposure for several minutes or more, then they're medium risk and they must wear a disposable mask. So labor and industries, you're saying what enforcement are you seeing on this mask issue? Well, I was going to say on the vendors, L&I is going to hold you liable because you're doing business with them, so you do have control over them. And so they will not take that as an excuse. And L&I is going to be sending their DOSH investigators out starting this week. In fact, in many of the emails we've been doing with L&I, we've got some feedback there. The feedback we've been getting they've been copying the inspectors. They will be coming in to the stores. They will, if they see an infraction, they will educate. They've been informed to educate you. And then the next time around, if it's the same infraction, the starting penalty is $9,600. And let's see, what else do we have to cover? Oh, I wanted to ask Larry at Baker at Bunzel to cover issues about supply. If you can just give us an overview of where you're seeing things from Bunzel's perspective. Rebecca, is Larry unmuted?
He's muted on his end, so he just needs to unmute himself.
Super. Hopefully, Larry, you heard that, to unmute yourself. Larry?
Now he should be able to talk. Larry, are you there?
So, Larry? Larry normally does very well on these kind of webinars here, so
I think Allie wanted to chime in if we have time to.
okay. Well, let me see if we can HIJKL. Looks like everybody's oh, but I see Larry is unmuted. Okay. let's what Larry has told me is right now he has a lot of disposable masks, the lightweight blue ones. He's got a lot of those in inventory because there hasn't been a great demand, because that's not, we were told just 2 weeks ago or a week and a half ago to cloth masks for everybody. So he does have quite a good inventory at this time, but and the prices have gone down on those masks, but they're still much pricier than they were prior to the COVID. So there is supply. Hopefully prices will go down. Larry did tell me though that they are having a real shortage of gloves. So that's going to be a challenge. So questions do you think Ellie has a question, or is she just talking to somebody else in the background?
No, she put her hand up, or
Oh,
the
okay.
little hand raising thing.
Yeah, okay.
So
Ellie?
Jan, this is
Yeah, can you hear me?
Yes, we can, Ellie.
Okay. I had two quick questions. One is, I have a vendor that tells me I'm the only store that's requiring my employees to wear masks, and that if a store tells him he has to wear a mask, he's not going to work the product. He's like, so I don't have the time. I mean, it's a vendor that's in there 5 days a week, and he says that his boss, it's Frito-Lay. And he said his boss told him that if they make him wear a mask, that he can just leave his product on the back dock and that we have to work it. But I'm still liable for him when he's on my floor because, yeah, customers are going by him constantly.
Yes, you are.
Okay, so we have to just decide whether we want to spend the time doing their work or
I would say that's
forcing the
pretty
issue.
poor customer service on the part of Frito-Lay. And would it be helpful if we get just a memo from Labor and Industries that states the stores have the responsibility to assure their vendors are masked up according to the risk?
Maybe, because that was part two of my question is, I mean, thank God we have you guys and we have these webinars to find out all this stuff. But if we didn't, and there are a lot of stores that, especially convenience stores that don't have this access, how are they supposed to know? I have not seen anything from L&I or Dosh or anybody with saying, hey, we're changing the rules for you. So how are they not responsible for letting us know? I mean, like I said, thank God for you guys, but without you, there's so many things we would not know or understand.
Because they expect you to go on the governor's website every day and see what new proclamations he issued, and then they expect you to have daily contact with staff of L&I and Department of Health to ask them if they have any new guidance for the day. So
Hi, so ignorance is no excuse, huh?
No, hi, this is Kat, real quick. I actually just hopped off a all business call, and WFIA, we are actually ahead of almost all businesses in the state of Washington. So we have been keeping up and knowing what's happening before anyone else, and I truly think it's because we have Jan and Tammy leading the way, making sure that all of you know what's happening. And it's astounding how many of these other businesses are experiencing the same problems as you all, but they haven't been able to reach out to the governor's office or L&I or DOH, whoever we're talking to at that moment, to figure it out. And so I just kind of wanted to showcase how much really Jan and Tammy have been doing to make sure that you all get the information, because our members, we are really the only ones who are actually following the rules as we get them, because most of the other businesses are way behind.
Hey, Tammy, Jan. This is Mike. Can you hear me?
Yeah,
Yeah.
sure can, Mike.
I don't need an answer on the first thing I'm about to say, but I'm going to make the assumption that all of the idiots at L&I were the ones that created this stupidity. But then what I'm looking for clarification on is
I will
there any
answer your
science?
first one. Let me answer your first one. You know where this came from?
Governor Inslee.
It came down from CDC first.
Mhm, yeah.
There's a CDC document that this language is pulled out of. So complain to President Trump. So it did. It came from CDC down to the governor's office, who then issued this document and told L&I what they were going to do. So answer for the first part. Second part, go.
Okay. Is there science to back up the logic behind the use of the two different masks?
So how do you spell science? No, and I shouldn't be sarcastic because at Forest State staff are working 20 hours a day. I feel so bad for them. And the agencies are as confused as we are because directions coming from every which way, and trying to get an answer out of the governor's staff has become extremely difficult as they've opened up the state. There's more and more industries that are asking questions, and it truly is chaos. So,
yeah. Well, Jan, you have every right to be sarcastic.
I've been known for that anyway, Mike.
So I just want to get clarity around something.
Okay.
When we talk about courtesy clerks, are you saying that definitively because they are not behind the plastic shield that they too have to wear a disposable?
No, if you look at the last sentence of that second paragraph under medium, it says prevention measures such as a physical barrier. That if you have the plexiglass at the checkout stands, that would move your cashiers to low risk so they could wear a cloth mask. But if you have a bagger standing there that's not behind the plexiglass, they would remain in the medium risk and would require disposable.
Okay, that was a question that I had. So I want to go back for further clarification, because we do have a percentage of employees that wear face shields. And I just want to make sure that somebody's not going to, out of the air, decide that face shields are not going to be acceptable tomorrow afternoon.
Actually, they're not, unless they're wearing a cloth mask under it, or they have a medical document that says they can't wear a cloth mask. The shield is not an acceptable means of protection.
Does it have to be a registered doctor?
You know, following ADA guidelines, I mean, you can't ask very many questions. And so if somebody tells you they have a medical condition and can't wear it, and that is documented, you've done your due diligence.
Okay. Well, I was going to say I could become an ordained minister this afternoon if I went online. I could become a doctor real quick to get these notes out.
Oh, gee.
Hey, Larry, or hey, Mike, I am actually an ordained minister, so I can do that.
Oh, okay. Let's see. Let's pause and see if Larry ever got.
Can you hear me now?
Yes, we can hear you.
Oh, that's good. I was on my phone. I called in on my phone and I couldn't see where I was muted, so I apologize. To Mike's last question too, they don't say what kind of doctor you have to be. So there you go. You could be a doctor of anything you want, Mike. And that works.
A doctor of logic.
Yeah, there you go. Masks are so interesting because the World Health Organization came out today and said masks are worthless unless you're an actual person who is carrying the virus and you're sick. So that's the World Health Organization's note today. So we'll see where this all goes. But The masks are interesting. When they first came out, they were not from certified facilities. They were being made in garages and stuff. And so there was some caution to make sure that they were certified facilities, which most of them now are certified. But masks went from a dime, less than a dime in January to up over 50 cents in the last couple of months, and now they're dropping steadily. So the new price on masks is in the 30s and dropping into the 20s. And so some of the conservative not wanting to buy containers of masks that cost 50 cents when the price is going to drop. You will see now significant quantities available. We've got significant quantities today coming in and also on Friday, so there shouldn't be an issue as far as the bundle group goes in the 3 warehouses in the Northwest, being Portland, Spokane, and Seattle. And those costs you're going to see drop significantly. I wouldn't be surprised if by July we start to see things in the teens. So that part is good and kind of explains masks and why not to get too crazy into stocking them up. There's a lot of downward pressure. The KN95 masks that are listed here, a couple of weeks ago, KN95s were not approved and said don't use them because they're basically a dust mask. Now they're telling us to get KN95s. We've had the K95s, which are the medical masks. The KN95s we have also coming after talking with Jan yesterday. So those will be available. That's what you see on this picture. Those will be available shortly. The blue masks are basically exam masks for medical, but that's what they're talking about here. So those surgical style masks are the ones that would be approved according to this information, according to today, could change tomorrow. So that's what I know about masks, but you should be able to get quantities that you need and should be readily available now, particularly from us, but throughout the market. Gloves are a problem. We can't really go after the glove manufacturers for gouging, but that's what's happening. We're seeing spot prices in China today for nitrile at $110 a case. We were in the $40 a case a month ago. So you're going to see glove prices spike, and then they keep pushing it out our containers as they're taking the highest bidder on containers. So we're not even able to get confirmations on gloves. We have just in the Seattle market, we have 91 containers of gloves ordered between now and the end of the year, which is about 5 times our normal usage. Just trying to get those because we recognize usage is up there. But gloves are going to be a short-term issue. We've kind of had to allocate them, and we're struggling right now on gloves, as is everyone, as more and more people are required to wear them. And there wasn't really time to react, and there is no U.S. manufacturing of gloves. They're all either China or Malaysia. Malaysia was closed until 3 weeks ago, so all of their production just barely got started. And again, they're taking highest bidders on gloves. So that's where the bigger challenge will be right now. Sanitizer, we're seeing some relief starting to come on sanitizers and a lot of local available. Heritage is one that we're talking to try to make it easier for them to get out into the market, and that's a local company that is out there. So sanitizers, I would expect to see some relief in those areas. So that's really masks, gloves, and sanitizers. Jan, I gave you 3 instead of 2.
I appreciate that, Larry. And just a reminder to everybody that Heritage is a great member of ours too, as well as Bunzel is. So please trade with our members. So thanks for the info, Larry. Hey, Rebecca, do we have any, I see some unmuted people. Do we have any questions pending?
It looks like someone has been busily answering them in the question pane. Have we been able to determine the definition of close contact?
Within 6 feet. I mean, you're supposed to keep the distance of 6 feet. So if you're within 6 feet and you're interacting with them or for several minutes, it says. So if you look at that, several minutes. So so if the same two people are standing right there and you're within 6 feet of one another and stocking shelves together or talking pricing on your wines or whatever, yeah. What else we got?
I asked two health departments, and they said it was 6 feet for a period of 10 minutes or more. That's when I put together my plan.
Right. This is Mike. I was just going to add that too, that it is less than 6 feet for more than 10 minutes.
And I did have a question. I wasn't quite clear on a cloth mask and a face shield equals medium risk coverage.
Yes, there's another document from L&I, and it has that clarity specifically outlined in it.
Did you get that posted, Tammy?
Yes, it should be posted. I'm gonna double check because I was just sending it to another association that didn't have this information as well.
Okay, we'll make sure it gets up on there so you guys have, if L&I comes in, you have an inspector that says, no, you could go, here, this is from L&I right here. So we will keep that kind of stuff posted for you. And I think if I'm right, Melissa, Kat, is it under labor resources that you're putting this kind of stuff, or well, I don't know, it's kind of spread them out. Just call us and we'll tell you where to find things if you can't find them easily.
Okay, next. I have a great deal of background noise, so I'm typing my question. I have several about doctor's notes. I have several notes, and generally they say the employee is asking us to ask you to not wear a mask due to anxiety and stress. They are not clearly stating, please excuse the employee. What level of clarity is acceptable for a doctor's note to excuse an employee from wearing a mask?
If you have a doctor's note and it's documented and it has to do with anxiety and stress, you don't want to probe too far into that. You need to respect, if the doctor says it, then you're covered and you've documented that you've met with that worker. You're trying to develop a process to make sure that there's 6 foot social distancing since they cannot wear a mask. I would try to get them to wear a shield if they could, but if they can't, then focus on that social distancing and document that you've talked to them. This is their concerns, and this is what you're doing to try to prevent exposure.
This is Elvira from Town and Country Markets. On the beginning, Jen said there is going to be a document that we can print out and have employees sign it, and that's going to be equivalent to a doctor's note. Did I misunderstood that, or is that still an option?
It is, L&I is not saying it's an option, but a number of our stores are doing it. Rosars is going to share their document because some people can't even get into their doctor, or they don't have health insurance, or there's multiple reasons, but at least you've done everything as an employer. And until L&I tells you no, that's not good enough, go ahead and have them sign the affidavit if they've tried to contact their doctor and they can't make connection. The doctor should always be your first line of defense, then the signed affidavit.
Great, because I called my doctor and the answer is we're not going to approve that. We actually have a policy that we just got saying, do not approve anything like this.
Interesting.
So that's why I was like, what do you mean you cannot? And she's like, I can't. It's the policy that came to us and I can't do anything about it, which I understand totally. It was just, I'm like, oh, all of a sudden you got a policy for this?
They're probably getting bombarded by calls and emails.
That's what I was thinking. So I'm glad that there's at least this document that we can put it in and be safe. Thank you.
Well, again, Ellen and I didn't say it, and the governor's office didn't say it. It's showing your best effort as an employer. and not stepping over the ADA line.
Perfect. That's all we need. Thank you so much.
Yeah, you betcha, Elvira. Looks like Bert Paul had a question, and did I see that?
Who?
In the question box there.
Oh, yeah. So the next one down is there any analysis going to whether this is in fact legally enforceable? A guide is not rulemaking, and while I recognize these are different times based on the public emergency, there have been issues on enforcement across the board.
And you hit the nail on the head. These are unusual times. It's considered a state of emergency declared by the governor, and it gives government powers that they don't typically have. So nobody has challenged it legally to our knowledge, and it sure won't be us.
Do we know how long this mask rule will last?
Nobody knows. It's phase 3 has the same requirement, so we don't know. I don't think the governor's office probably doesn't know.
And then someone else has been told by doctors that they're not writing excuses for masks.
Yeah, well,
that seems pretty.
LNI and the Human Rights Commission are going to have to put their heads together if it becomes an issue to them. Because as an employer, you can't step over the ADA line. So get your affidavits on file that says that the employee has a medical issue, and besides everything LNI is doing, again, let me stress, education first and penalties only after you ignore what they had to say. Anything else?
Yeah, this is Brenna Davis with PCC Community Markets.
Hi, Brenna.
Hey, how are you?
Good.
Good. I just wanted to, if everybody on the phone uses Instacart, I just wanted to let folks know and just re-up this topic of premium pay for delivery. The King County Council, or sorry, City of Seattle City Council is considering adding premium pay for deliveries, and Instacart has intimated that they potentially would withdraw from the market if they did that. So just want to flag that for the group.
Thanks, Brenna. And we have been, Instacart's a member of ours, and we've been on daily phone calls with them. And they have engaged Rob McKenna as their legal counsel. And so we are working closely with them, and we'll be having a discussion with our executive committee and board in the near future on that issue.
Okay, awesome. Thanks, Jan.
Yeah, the city council delayed action on it yesterday because they found that impeaching the mayor was more important than putting a premium pay on the cart. So I don't know how she fared. Anyway,
it was wild out here. Thank you, Jan. Much appreciated. Just wanted to let everyone know.
Yep. Any other questions before we move on to other topics here?
Yeah, Jan, I guess just to follow up a little bit on the mask thing, you said it follows through into phase 3. Are we still on the same schedule for the next phases? Is it still, I think it was like 21 days before phase 3 can start? Is that still the timeline that we're on?
That's the minimum standard the governor has set, and there are certain requirements. So if a county is in phase 2 and they've had phase 2 for 21 days, but they still haven't been able to meet the criteria of the governor's office, then they don't get to move to phase 3.
Okay, so, but at a minimum, we're 21 days. I'm just thinking about how many masks to order and stuff like that. So
At a
if
minimum,
this,
yeah.
okay,
Yep.
thank you.
Yep. Anything else? No? Okay, you can jump in. Oh, and interrupt me, Rebecca, if something pops up or somebody raises their hand. Talking about phase 3 that Don Stoles just talked about, they if your county is in phase 3 or about to move to phase 3, there is a document under new this week, and it is a safety plan. It's a nice document that we have found productive out of government, and it gives you a checklist of what you have to do and checking it off to move into phase 3. So it's your document to download and go through that and be ready to move into phase 3. And it is a document that likely L&I will ask for as your safety plan. If you go into phase 3, we expect to see the same type of document issued once they get the guidelines for phase 4. We are still waiting. The Department of Health, I should say, is waiting for clarification from the governor's office on self-serve salad and hot bars and bulk food scooping. As you all know, remember, Department of Health issued, yes, open them back up for phase 2. And within a few days, the governor's office said, shut them down, no self-serve salad and hot bars. Department of Health and our office have called the governor's office daily for the past week, going, we need clarification. We still do not have it as of 15 minutes before this call started. Now, Kevin Stormans did ask a question on email a little earlier today saying, is sampling permitted in phase 2? Sampling is not permitted if you're talking about the regular type of sampling of one product at a special stand. But if you have a deli and somebody wants a little taste of a salad in the disposable cup, yes, that is allowed as long as your employees are remembering the 6-foot distancing. I'm going to keep going through this. If you have questions, just jump in there. Next up, Ern West, who's our great manager of our workers' comp retro program in safety. Mike Octave is our manager of our safety program, and he does an awesome job. Mike created kind of a draft COVID safety plan. It's a little different than TNC did. But is there for your resource. Mike, did you want to add anything in on that?
No, I just,
okay.
Can you hear me?
Yep, I can.
Yeah, no, I just want to let everybody know, Town and Country put, and Mike Latham did an excellent job of putting something together. We put some, material behind it as well. We just created a safety plan, just a different flavor of it. But, as Pam Kant from L&I mentioned last week, if you're on the call, L&I is requiring a safety plan, and there's a lot of different templates out there, but we want to make sure that WFIA membership had something that they could use and tailor. So you can throw your logo on it and create it however you would like. And I would just want to point one other thing out just real quickly. We're talking about the face mask. One of the issues that we're seeing out there in the field, if you haven't already, is the fogging of the glasses. Employees who are wearing glasses, we're seeing a lot of complaints regarding, not being able to see because the warm breath coming up through the mask. So just be aware there's some products out there that can help reduce some of that. So anyways.
You mean help reduce the fogging on their glasses, that they would wipe on their glasses or something like that?
Yeah, there's some practices like that. Yeah, there's some anti-fog And then there's also tightening your mask around the nose of the bridge of the nose can help reduce that, and taping some of the airflow over your face. Not with duct tape, but some type of it's like sports tape, that can peel off to reduce some of that, because that is definitely an employee and a worker's concern is being able to see, and that becomes problematic. So just FYI,
Okay.
when you guys are.
Thanks, Mike. So next we have
Jan,
a couple. Yes.
before we go on, a couple of questions have come in multiple times. I think I missed it the first time through, but question for Larry and Bunzel. Can you provide a date when the cost of disposable masks will drop to 30 cents or lower for delivery?
You should see that in the next, from where they're at today, you should see that with the next batch that we have. So I would expect as we're loading them, you'll see relief by Friday, Monday at the very latest. So we just have to get it in through our system.
And then, do we need the EarnWest safety plan as well as the phase 3 document?
Mike?
So, and I just have to be honest with you guys, I just saw the phase 3 today, so I haven't had time to really look through it. But I'm probably assuming there may be some differences in it, but it's all pretty much pointing in the same direction under the stay-at-home directive. Making sure you have a plan for people who are sick, making sure you have a plan for sanitation, with the mask, PPE, all that. There may be some variations on it, so it's something that we can take a look at. But I think the on the bigger picture, Illinois is looking for making sure businesses have a specific plan that's written down that they can refer back to, and they're addressing the areas of concern.
Thanks, Mike.
Where is the safety plan that they can download? Which heading did it go under?
There's the top doc is COVID safety plan template by EarnWest, and then the one for phase 3 is down the 4th document, phase 3 safety requirements to be included. Yeah,
both
there.
Under new this week, right on the front.
Yeah, and then Mike with Town and Country, his was up new last week and got moved. It's much more comprehensive. It's more than just a safety plan. It's a whole operation plan. And I don't know, maybe Melissa can tell me where she moved it. I haven't pulled it up since it got moved.
Jan, which document were you talking about? Sorry.
Town and Country's plan.
Well, we changed the name so it doesn't say T&C. It's under, I believe, the opening. What is that? Sorry, reopening Washington. So if you go under that category, it should be in there.
Okay.
Yep. But if not, I can do some digging.
Yeah, let's put it back up since we're doing phase 3 here. Let's put it back up under new this week so our members have options of three. Well, they don't have an option of using Illinois' phase 3, but yeah.
Jana, I found it. It's okay. I found it. It's at the bottom of the new this week. It's a COVID-19 response plan updated.
Okay.
So it's an editable version, so they can remove Town and Country on it. But that's the last one that Mike Latham sent to us.
Okay. And again,
what I will do is I'm going to look at the phase 3 and the COVID-19 response plan, because I have a feeling that a lot of that is included, and we'll try to have one document that covers everything you might need. So I'll make sure it's included in the response plan, so you've got it in both places.
Okay, did we get everybody's questions before I jump to the next one? This is all real important stuff with all the new stuff flying at us. Did Bruce call? Did we get Bruce's question in? I'm assuming was one that we read or something.
Yes.
Okay. All right. So I'm going to jump then to cover sampling safety. Oh, survey. I want to put some survey questions up because the #1 call we're starting to get into the office now is all about trying to find people that want to work, because Congress really messed up when they added that additional $600 bonus to unemployment insurance and removed the work search requirements. And the employment crisis is really increasing in our industry because you're all so busy. So we are going to be doing some major communications with Congress to make sure that they move things forward in the right way. And I know Governor Inslee is looking to call a special session. We want to have this information to back us up to make sure things move in the right direction. So our first survey question, I hope you're all still on there. Do you have that up, Rebecca?
Do you want the one about from ESD or the open positions?
Good. Just start. We're going to go through all three of them. Go ahead and start whichever one you got. Okay. This question has been coming to us. If you are a base year employer, somebody has applied for their unemployment insurance and you're a base year employer, you have the right to say, no, that's non-charging. That person left my employment on a voluntary basis. We are getting reports that people are getting those as base year employers notices after the deadline or just a day or two before the deadline. So tell us if you have gotten any of those notices as a base year employer. If you've gotten those too late to respond. So, okay, next question.
And Jan, that was about, it was 47% yes, 53% were saying no. So.
Okay, well, that's way too high of a percent. Yeah, that's way too high. Okay.
So Jan, can I say anything on that, or do you want to talk about it afterward?
Let's talk about it afterward.
Okay.
And Kat's going to jump in too. So, do you have open positions of employment in which you have been unable to hire a worker? And unable to hire a worker because nobody's coming in and applying. So do you have open positions in employment? And then we're going to, the next question is going to be asking you why. So the next question is that a lack of applicants or a lack of qualified people? I think I know the answer to it, but we have to have your answers to back us up as we're lobbying Congress and the state legislature. Can you tell us, Rebecca, what the answers were to the last two questions regarding staffing?
It was yes, but they mostly, I think it was about 65% that they were not able to fill positions, they'd open positions. And this is 68% is a lack of applicants, 32% lack of qualifications.
Very good information for us. Very good. Thank you for participating in that. So now I'll turn over to Tammy, and then Kat's going to do follow up on the federal legislation to address some of these issues.
Okay, thank you. So I did reach out to ESD on this issue of the timeliness of those letters you're getting. Obviously, ESD is very, very messed up right now, and they realize that they're not getting those sent out. So if you just document the date you received it, and if you have disputed all, get it disputed and get it back to them, and just document the date you received it. And they said that they will respond and react based on that, because they know that they are not getting those out timely. So thank you.
Thanks. Kat, what are you doing to fix this issue?
Well, this issue, well, what I have is slightly different than the issue that you're talking about. So there are two federal bills that WFIA and our national partners are supporting. Both bills provide tax relief to essential workers, which we had previously sent out a voter voice alert about before. We will be sending out another voter voice alert, which will be slightly different, as this time we will be asking representatives and senators to co-sponsor specific bills. The first bill is HR 6841, the Assistance and Gratitude Heroes in Agribusiness Who Are Invaluable to the Nation Act of 2020, which is also called the Ag Chain Act of 2020. It was introduced by Representative Thompson, who is a Republican, and Representative Evans, who is a Democrat, both of Pennsylvania. The second bill has not been introduced yet, but it will be introduced by Senator Ernst from Iowa, who is a Republican, and it will be called the Financial Relief Noting the Large Impact of Our Nation's Essential Employees Act. Both of these bills would recognize the heroes serving at the front lines of the food and agriculture industries by extending income and payroll tax relief for income earned during the pandemic. And this does include the additional check that some of your employees may have received. So you should be receiving an action alert sometime tomorrow. So please keep an eye out and take action. Thanks.
And Kat, when you're developing the messaging for our members to use, would you please put something in there to talk about the harm that the $600 bonus has created in terms of taking away any incentive to go back to work, and use the information that we learned from our members today on lack of applicants. So we want to make sure, we've been told Congress is not interested in extending the $600 bonus past the end of the month, but we want to make sure our congressional delegation's hearing from us. So please, please respond to that. It's important for us to offset that $600 by giving your working employees an incentive too, kind of a bonus. So Tammy, what do you have lined up for us next week?
Okay, great. So a couple of things following on what we were just talking about. I'm hoping to have some more information for everyone. I'm going to be reaching out to some of the WorkSource locations. I want to talk about careers in grocery and convenience, and really to start getting that message out so they understand value in that, and they can be sure as people start coming in, when they are required to do job searches, that they're aware of opportunities that our stores have. So I'll have more information for you on that. But big news, we will have Mark Costello back from the Small Business Administration to talk about the Paycheck Protection Program updates. They passed some new legislation on that, and so he will have more information for us next week.
Okay,
that's what I have so far.
Thank you very much. And of course, I'm sure we'll have updates on masks next week too.
Yes.
So I want to remind everybody that we all need to be lifted up during this challenging time, and hearing from our members about stories of acts of kindness in your community that you do to lift your community up brings all of us joy, and we love putting that on our Facebook, our website. We really want to hear those stories and see pictures if you have any, and share, because we all need good news right now. So please do share your good news stories with us. And until next week, you know where to find us if you have any questions. Thanks for joining us.